We started using EMIS Web in June 2016, and then a few months later the really exciting stuff happened when we planned to go live with each of the community teams with mobile working.
EMIS Mobile is our product that allows clinicians working in a community setting, looking after patients in their own homes as an example, to have full access to that patient's clinical record at the time that they need it to support the best care possible for them to provide.
Before EMIS Mobile, the district nursing service used a card system for allocating their work. So each patient had a card with the name and their address, contact numbers, next of kin and what they required a visit for, and then they would write them in a diary and take them out on the visits. They would record in the patient's notes, and then we would have to return to the office and then input that same information on EMIS Web. We no longer have to do that, so that can possibly save us up to an hour a day of inputting data in the office.
The difference that EMIS Mobile has made to our day-to-day working means that we can go into a patient's home, we can have real-time access to all the notes from any member of the community team, we can have access to results for patients, we can refer them to other services, we can reschedule visits there and then in the house so we're not having to remember to do it when we go back to the office, and it just makes our service much more efficient and gives us much more patient-facing time, which is what we need.
So in developing our products, particularly EMIS Mobile, we work really closely with our customers to make sure that what we develop is what meets their requirements and really meets the needs for them doing the jobs that they do. We work with them to get their feedback, we make enhancements, we really change the products and develop them in terms of what their requirements are.
The initial training sessions for the first team, we had somebody from EMIS come and deliver them, and that's what we needed. We needed that push and that reassurance and that feeling that if we did have an issue, it was going to get sorted out there and then. Once we'd got that initial team going, they saw the benefits, and then that sort of gave us some momentum, and the other teams sort of were ready to get on board too.
So our next steps that we're working towards at the minute are sharing with our GPs, we're sharing amongst all the community services, and we want to start looking at our reporting and how we can use that to improve our patient care.
It feels like it was years ago, but it was actually earlier this year that we went live with the EMIS mobile app, and now it feels like we can hardly remember the way that we did work, and it feels like this way is so much more improved, so much safer for the patients. Everybody gets the information that they need in real time, and it's just beneficial all round.